Welcome to Save With CPR's Child CPR, AED, and Choking Training video. Today we're going to cover child chest compressions, child rescue breathing, child AED application and use, child team CPR, child choking, and then we will review the training. Chest compressions in a child require you to place one or both of your hands directly over the lower half of the victim's breastbone. You will need to lock your arm and push down about 1/3 of their chest or about 2 inches. You will then release all of the pressure off of the victim's chest. This should be performed 100 to 120 times per minute. Child chest compressions are very similar to adult chest compressions. However, you may perform one-handed chest compressions if you are more comfortable or to prevent yourself from going too deep. Make sure to ensure adequate chest recoil after each compression and do not rest on the victim's chest between compressions to allow the heart to fully refill with blood between each compression. Here we can get a look at a rescuer performing chest compressions on a child patient. Our child patients, again, are ages 1 to 8. You can use 1 or 2 hands placed in the center of the chest, 1/3 the depth of the child's chest, or about 2 inches at a rate of 100 to 120 beats per minute. It's really important to understand that one of the main reasons children and infants go into cardiac arrest is respiratory failure. That is to say, that rescue breathing in children and infants is extremely important. This rescue breathing allows you to replace depleted oxygen in the victim's blood. 2 options of rescue breathing are mouth to mouth, or you could also use mouth to mask, depending on availability, and bag valve mask ventilation. With either technique, you will want to provide 2 breaths, stopping once you notice chest rise for every 30 chest compressions. Now let's cover child compression to ventilation ratios. If you're acting as a single rescuer, you should perform a compression to ventilation ratio, or CV, of 30 to 2. That means after 30 chest compressions, you should perform 2 rescue breaths. However, children and infants have a higher baseline demand for oxygen, and low oxygen is a leading cause of pediatric cardiac arrest. So that means if you have multiple rescuers and can effectively do so, you should utilize a CV ratio of 15 to 2. That means if you have multiple rescuers, you should deliver 2 breaths after every 15 chest compressions. When giving child mouth to mouth or mouth to mask, pinch the child's nose closed or place the mask over their face. Tilt their head back, being careful not to extend too far. Place your mouth over their mouth, forming a seal. Exhale 1 breath into their mouth, watching for chest rise and stopping when you see their chest rise. Then, taking a breath, exhale 1 more breath into their mouth, just as before, having delivered 2 successful rescue breaths. To use a child bag valve mask, place a child-sized BVM mask over the victim's nose and mouth, using your thumb and index finger with enough pressure to form a tight mask seal. Then tilt the child's head back while keeping a tight mask seal without extending too far. Deliver 1 breath over 1 second, stopping when you note chest rise. Release the bag over 1 second, allowing the child to exhale, then deliver 1 more breath over 1 second, again stopping when you note chest rise. AEDs are to be implemented immediately upon availability during your chest compressions and rescue breaths. The person delivering the AED should be directed to work around the chest compressor to deploy the AED. Most AEDs have separate pads or modes for children and infants to deliver a lower energy. If present and able, use the child pads or child AED mode. If unavailable, you may use adult pads or mode on a child or infant. You may also apply an AED if you are by yourself and happen upon one. To operate an AED, follow these 3 simple steps. Turn the AED on, place the pads on the victim, and follow the AED prompts. Make sure to avoid touching the patient while the AED is analyzing and during shock delivery. For a child, place 1 pad on the center of their chest over the breastbone, with the other pad placed on the center of their back opposite of the first pad. Make sure to avoid placing the pads on breast tissue, over clothing, over medical patches, or bulges in the skin. If you have multiple rescuers, one person should establish themselves as a team coach. The role of the team coach is to ensure all important steps are being taken effectively and to promote effective communication. An effective team coach will identify and designate a person to activate 911 and ensure responders have access to the area, especially if behind locked doors. Identify and designate a person to perform chest compressions and switch them every 2 minutes or earlier if they get tired. Provide encouragement and coaching to the chest compressor if and when necessary. Identify and designate a person to retrieve the closest AED and deploy it. All of the steps of CPR need to be performed, and having a team with a team coach allows a resuscitation to happen quicker and with greater efficiency. Children may choke for any number of reasons. It is important to quickly identify a choking child and respond appropriately. A choking child may or may not appear in distress, as the first few moments can be filled with confusion and panic. You will need to determine if the child has a complete airway obstruction or a partial airway obstruction. Is their airway completely blocked, preventing any airflow, or is it just partially blocked, allowing some airflow? For a victim with a complete airway obstruction, you will want to attempt to dislodge the object and relieve the choking. Victims with partial obstructions that are able to move air and speak should be monitored until first responders arrive. Remember, do not forget to introduce yourself as somebody who knows choking relief and obtain permission to intervene. Let's take another look at comparing complete obstructions and partial obstructions. A complete obstruction, the victim has no ability to speak, no ability to scream, no ability to breathe. In response, we should attempt choking relief and call 911. In someone experiencing a partial airway obstruction, they may be able to speak, they may be able to scream or screech, and they may be able to move some air. In this case, we call 911 and monitor. If it becomes a complete obstruction, then we will attempt choking relief. Child choking relief may be performed with abdominal thrusts. To properly perform abdominal thrusts, wrap both hands around the abdomen just above the belly button. Form one hand into a fist with your thumb facing up and into their abdomen, and your second hand wrapped around your fist. Pull in firmly and brisk, repeatedly until the object becomes dislodged. If choking relief fails and the person becomes unresponsive, start CPR. Take a moment, pause the video, go through these questions on the screen, through the student manual to be able to answer these very important questions. Once you've reviewed the next section of this video, we will break down the Child CPR assessment tool and the actions you will be required to perform in order to complete the Child CPR module. In order to complete the Child CPR, AED, and choking relief module, you will need to be able to demonstrate and perform all of the skills required to do child CPR. When it comes to rescue breathing, you may either use mouth to mask, or BVM. You will be given a scenario for a child who is collapsed. You will have to respond appropriately. You may perform as a solo rescuer, doing all of the actions yourself, or you may work in groups to do team rescues. However, every individual must perform all of the different skills. The assessment tool starts out with the initial scene management, where you have to check for breathing and responsiveness, spending no more than 10 seconds, and then you must call for help, direct somebody to call 911, and retrieve an AED. You'll be informed the victim is not breathing, not responding, and does not have a pulse. From there, you will need to immediately start chest compressions, performing high-quality CPR with proper hand placement, proper depth, allowing for chest recoil with a right rate and rhythm. As a single rescuer, you will have to perform 2 rescue breaths after 30 chest compressions, without delaying chest compressions for more than 10 seconds, ensuring chest rise, and stopping on chest rise. If you're performing multiple rescuer CPR, you can use a 15:2 compression to ventilation ratio. You will then need to immediately resume chest compressions after giving breaths. The moment an AED becomes available, you will need to deploy the AED while continuous high-quality chest compressions happen, turn the AED on, place pads on the victim, follow the AED prompts, and safely deliver a shock if prompted by the AED, and resuming high-quality chest compression immediately after shock delivery.